Hey, this is Dr. Darwin, and welcome to another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and then life as a new dentist. Guys, be sure to continue to share this content. Only about 15% of the people that are watching these videos are subscribed. So we need some more of you to subscribe, all right? Also, comment down below and tell us more about things that you liked about these videos and the podcast so that we can continue to bring this content to you. All right. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. That's right. Look down below. GetIntoDentalResidency.com, the ultimate resource to help you navigate the process of getting some advanced dental education and also getting to board certification as a specialist. For more details, check the link down below, and we hope to see you in our upcoming training very soon. So today we have a special guest who's back after 3 years of finishing up dental school, and now he's at it again, is en route, and he's going to be talking a little bit more about his journey into oral surgery. Dr. Reed, welcome back. How you doing, man?
I'm doing great. Thank you for having me.
You're welcome. So give us a brief introduction. Tell us about yourself for those that maybe didn't watch the last episode a couple years ago, so we know a little bit more about you.
All right. So hello, everyone and future surgeons. I am Dr. Sheream Reed, a captain of the U.S. Army and current advanced education and general dentistry resident at Joint Base Lewis McChord in Tacoma, Washington. I'm a native Philadelphian, achieving my Bachelor's of Science in Natural Science at the University of Pittsburgh, Master's of Biomedical Sciences at Geisinger Commonwealth School of Medicine in 2018, Master's of Health Sciences at Meharry Medical College in 2020. I hold certificates in public health and health policy while achieving my Doctorate of Dental Surgery degree in 2024 at Meharry Medical College School of Dentistry. And I am delighted to be here today. Thank you.
And which is important. It's important to have mentors. It's important to have connections with people, whether it's getting into dental school, getting into residency, but especially when you're getting into residency, you want to be able to connect yourself with people that have done it and have the insights, have the tips, can share some advice as well. So that leads me to our next question, which thank you everybody for staying all the way through to this probably most important part of all of these podcast interviews, which are tips, advice. So Doc, knowing what you know now, especially since this is or has been a successful application cycle for you last time, but it wasn't your first one, right? Things happen for a reason, right? But having that experience of applying to oral surgery, knowing what you know now, what are some tips and advice that you want to share with applicants who are listening and watching right now, knowing what you know? What are like 3 or 4 or 5 things that they must do right now? If they didn't learn anything else from our discussion today, what would those things be that they have to do right now?
All right. So we're going to get into that. So some of the things I'm going to mention are very fundamental. They're very foundational. They apply to every aspect of life. And so one of those life tips, be resilient. You're going to take many losses, but you got to get back up. Learn from those lessons and correct them as you correct them, and just be greater.
Now, key point here. Give us some examples of that, because some people may think they're being resilient, and it may not necessarily be getting them the result that they want, because maybe their definition and their actions on how they're demonstrating resiliency is maybe not quite right.
So I would say, for instance, in dental school, I failed some practicals. And what did I do? Did I, put my head down? And no, I put my head up. I just say, this is a learning lesson. I got back in the lab. I practiced. I sat down with my professors and just got better from it. Just try to have a positive mindset about it. At the end of the day, whether you get into oral surgery or not right away is not life or death. Life or death is like, your family and your family's health, your health. Those are at the end of the day, all this kind of doesn't matter in life. Your relationship with God, your relationship with your family, whether they're healthy. So try not to put it on a pedestal, is what I would say. But when you're in school, just you got to sit down and you got to correct any type of thing that is wrong or you may have not understood, and you got to break it down so that you can understand it. So being resilient is just overcoming those challenges and those losses that you encountered. Maybe in dental school, maybe you're taking the CBSE and you bombed it. Well, you need to get back in the lab and you really got to break down it to a science of why you didn't do well and just attack it. And the resiliency is not only like what you do, it's a mindset. So you have to say that I'm going to do better with hard work and with the time and with the mentors. I'm going to do better. Whether I have a lot of help in my corner or not, I'm going to overcome. So that's resilience in my thought process. But if you want to continue with those tips, I was going to say, be vigilant, be humble, but don't let a hard time humble you. As Nipsey Hussle said, you're going to be humble, but don't let a hard time humble you. And what I mean by that is, like you said, just get tough and still, don't put your head down. Put your head up with confidence. You failed an exam or practical, but don't just put your head down. Hold your head up and have the attitude that you'll kill it the next time. Some application tips that I have: prepare for the CBSE early. If you want to take anything from that, trust me, the people that they do it later, a lot of them don't do well. And they end up taking several gap years. And then by then, some of them don't even make it back to apply. And they end up just, they'll stay in general dentistry.
Now, you say early for CBSE. What's your recommendation based on your level of comfortability and understanding of the content in the exam and where you were at dental school at the time, meaning first year, etc.?
To be honest, I think it's never a better time to start. You start early, the earlier the better, essentially. However, in your D1 year, you do take a lot of core basic sciences like gross anatomy. You take a lot of these courses where that would help with that curriculum. The thing about the CBSE, it's all medical-based knowledge. There's very little dentistry on there. So like when you get into your D2 year, you're learning more dentistry-related courses besides like maybe pharmacology and like one other course. I would say after your D1 year, you should really go hard with the CBSE if at that point you decided you want to pursue oral surgery, because you don't want to, it's just so much information, and you're essentially learning what medical students learn in 4 years outside of your dental school curriculum. And at every dental school, it's not like at some dental schools, they take classes with the first year medical students. Harry used to do that, but after COVID, they no longer do that. So like for the people who are preparing for the CBSE are at a disadvantage. And I know at other schools, it's like that. But at some schools, they do take classes with the first year medical students. And so if you're definitely not in those classes where you're learning, with that same type of strategy, because their questions are completely different. They're definitely like third, fourth order level type of questions. Then you should start early for sure. You want to try to get a score or of a 50 or higher. But of course, in the civilian world, 70 or higher will get you to be a little bit more competitive. Can you get in the 50s? You definitely sure can. Like I said, comes down to who you know. Did you make a great impression at your externships? Things of that nature. My next tip would be make sure that you complete at least 3 to 4 externships throughout your dental school career. And preferably once you entered the clinic, they really don't like to see you until you actually have some clinical experience. I've seen some people that go before, but like if you're not even actually, or not teaching, if you're not actually seeing patients and treating patients, then some of these programs are going to say, come back once you get a little bit of clinical experience. Because you might actually, on these externships, they might ask you to, while you're on call, to suture up a maxillofacial wound or something like that. And it looks good when you actually know and have been treating patients.
Now, when you say 3 to 4 externships, are you talking about, of course, you're talking about oral surgery externships. They can be both within the school and external to the school, correct?
Correct. So if your school has a oral maxillofacial surgery program or any type of specialty program, then you can set it up so that you can spend more time with them. So that, you might be taken away from your core patients, but you are essentially spending a lot of your time with them. The exception to that is some schools, like at my school, they don't, at Meharry Medical College, they don't really give us time off to go on externships. So I had to go during my spring break, Christmas break, Thanksgiving break. And I had to sacrifice those weeks to really go on those externships and, of course, gain the letters of recommendation that I needed to be successful in the next application cycle. I don't know if that makes your point.
So Doc, what's the best way for people to get in contact with you if they have some more questions?
All right. Well, thank you for having me. And the best way to get in contact with me, you can message me on LinkedIn, Sheream James Reed. I'm also on Instagram, The Mad Scientist, spelled THA.MAD.scientist. And then Twitter, Surgical With It 06. And, just feel free to, if you have any questions about the process, especially if those who are going the military route, I'll be able to, guide you into the right direction.
Well, we appreciate your direction that you've given us as far as your journey and how that has directed you to your successful match into oral surgery. We wish you continued success, and we say thank you. Thank you.
Thank you for having me.
From the Alpha to the Omega, we making sure that you all are listening, get this information. Please like, subscribe, and most importantly, go to the next video right now. All right. Love, peace, and smiles. Go to the next video.
All right, sir.